Okay, so we already have our patient with their oral airway in. We have our gloves on, and of course, because we're dealing with airway management and everything else, we're going to make sure that we also have our eye protection on. So our oral airway is in. We're going to go ahead and use the CE clamp technique. So here's the C, and again, here's that C that we're taking a look at. And I am going to take the 3 fingers along that jaw, and I'll just switch this around for the camera. 3 fingers along that jaw, we're pressing down, and we're going to depress the bag over 1 second, and we're going to allow that chest to rise, and we're going to squeeze 1 breath every 5 to 6 seconds. After we have properly oxygenated our patient, it's time for us to go ahead and use our team partner, and our partner will then take over bag valve mask ventilations for us while we get our equipment set up to include our King Airway device. We've gone ahead and lubricated up our King Airway. We're going to remove our oral airway. We're going to displace the jaw with our non-dominant hand. With our dominant hand, we're going to make sure that we're at the corner of the mouth. We're going to insert, and we're going to rotate it back into position until we are at the level of the lip. Now we have to recall that each King Airway device actually is to accept a certain amount of air for the cuff. This particular model, or this particular size, which is in number 3, is actually going to take up to about a maximum of 60 milliliters of air. And for the King devices, it is one of the goals to make sure that they stay above 30 milliliters of air for all of the sizes that you take a look at from the manufacturer. So after we have inserted that, again, the collar portion is coming down to the mouth. We're going to insert the syringe, and when we inflate this, it will actually seat itself. So now this is now seated in here, and then we will take our bag valve. Mannequins are notorious for not really ventilating a whole lot with them. And you can see that the lungs are rising just a little bit. And that's all it takes to put in a King Airway. So in our patient right now, we've made the decision that we need to go ahead and replace the King Airway with an endotracheal tube. So we're going to go ahead and utilize our gum Bougie, and what I'm finding with it, at least for the mannequins, that if you just tilt this up a little bit where our notch normally is, we've already inserted this. This balloon is still inflated, and you can see this by it's being nice and firm. So we're just going to go ahead and insert our Bougie. Sometimes you have to manipulate the tube just a little bit, and now I'm starting to feel those tracheal rings. Now I've already passed this down. I can feel the tracheal rings, and if I wanted to take a look, I might be able to, but remember my balloon is still inflated. So I now have this in place, and I'm going to deflate my balloon. And now, because I'm doing the tube exchanger, I'm going to make sure that I keep an eye and keep a firm hold on my device, and you can see that this comes right through. The King Airway is actually designed for this to occur so that the Bougie is actually following through on a ramp that is through the tube. So we'll take that off. We've already checked our cuff. And if we had a team member here, remember if they have gloves, they have a job. we're going to go ahead and exchange this. And one of the other things that you need to take a look at is that you should make sure that everything is lubricated up. Everything should be lubricated up, and at this point I can go ahead and we're going to just move this to the side so that I can hold this, but I'm going to do it on this side. You can see that it does come out. Now we're going to inflate our cuff. And we successfully changed an endotracheal tube over a King Airway.